So thank you so much for joining us this afternoon. I am thrilled to have you all join us for a retina practice outreach presentation. I wanted to first introduce Bill, who is our retina practice outreach chair for Washington, for the Washington chapter. Ben, do you mind? Bill, I don't think you're muted, but I would like to pass it along to you if you'd like to say a word or two.
Can you hear me okay at this point?
Yes.
Great. My video was working just a moment ago, but maybe maybe not right now. Regardless, as long as you can hear me, that's fine. Thanks, Michelle. And hi, Michelle, the other Michelle. Long time. And Ben, nice to meet you virtually.
Nice to meet you, Bill.
Yep. And glad to hear the other folks, Marcia and Mike from the local chapter. Rob, if Rob's on, I can't see the gallery myself, so I don't know who else is on just yet. Regardless, Michelle, just say a few words. There's been some work and a lot of volunteerism here in the Washington chapter. Deeply interested in the outreach program and seeing what we can do to foster a little bit more awareness with respect to the foundation across a number of practices here locally and maybe even regionally. We'll see if we can get there. And I think the time has come, trying to put COVID behind us, and in the context of getting ready for our vision walk to get some traction. Better traction. Frankly, I think that probably falls on me with respect to getting our local chapter, talking to actual practices. We've done a lot of work to search, for individual physicians as well as their practices in terms of who our targets could be. And I think we're at a point where we can better organize and see how we can roll that out. For those who are not aware, I've been working with Michelle Glaze for some time, combing the internet and coming up with a candidate list. Oh, there's got to be at least a couple dozen, if not 3 or more dozen physicians across a dozen or so practices. And I had made cold calls to a number of them previously. And as you might expect, there's a lot of barriers to break down, a lot of tedious work to follow up on phone calls and emails. But I think we're still at the point right now where I think it's fair to grade us, A, for effort, but in terms of actual traction within some of these folks we want to get better acquainted with on an outreach basis. We still got some work to do. So anyway, I'm optimistic and glad we got a great team here on board and see what we can do to move the boulder up the hill a little further. That's about all I got for opening remarks, Michelle.
Thank you so much. And I just wanted to share everyone who is on our call before I introduce Michelle Glaze. We have Mike Hogue, Bill Wilcock, Susan Tanner, Marcia Christensen, Rob Relier, and we have Bob and Lupe. So at this time, I'd like to pass it along to Michelle Glaze, who is our Associate Director of Retina Practice Outreach, and she will be sharing more about what we do in the professional outreach realm.
Thank you, Michelle. And Bill, it's good to hear your voice. And Marcia, good to hear your voice as well. Ben Shaberman and I head up the professional outreach department. I'm sure that all of you know Ben, and certainly throughout the presentation, if there are questions or anything that arise, please feel free to chime in, Ben, you as well, as I'm going through the presentation, of course. But just to give those of you who don't know me a little bit of background, I've been with the foundation since February of 2019. I was brought on board to work with Ben on developing the professional outreach department and initiative. My background is in sales, business development, marketing. I have prior to joining the foundation, over 15 years of experience in working with a variety of physicians. The only group of physicians that I hadn't worked with professionally were eye care professionals. However, I have a lot of experience with eye care professionals as on a personal level. I was diagnosed with retinitis pigmentosa in 2004 clinically, and then genetically had testing in 2015 and actually further confirmed through genetic counseling in 2019 that RP1 is the cause of my vision loss. And so, you know, I kind of have the perfect marriage of professional experience with what we do with professional outreach, and then personal experience with the vision loss journey. So I'm really excited to be part of this team, and it's been really great to work with Ben and to see how this grows and develops. We've made a lot of progress, Bill, since you and I initially connected, and I've really refined this whole process with chapter-led outreach. Bill was one of my first chapter volunteers to kind of jump on board with outreach, and a lot has changed kind of since we got started. So Bill, I think you'll be excited to see some of this stuff too, and you know, I look forward to working with those of you who feel like this might be a good fit. So Ben, I'm going to open it up to you if you want to add anything, and if not, then I'll launch into the presentation.
Hold on.
Okay. All right.
I'm not muted, correct?
Okay. Okay. Did you have any ads, or do you want me to just dive in?
I just wanted to say hi to everybody, Bob and Lupe, Rob, Mike. Thanks for joining us, and Michelle, take it away.
Okay. So if you want to go to the first slide. So professional outreach, kind of the overview, our mission is really to connect with eye care professionals across the nation to raise awareness about foundation resources for individuals with an inherited retinal disease or age-related macular degeneration. And our goals are, you know, to develop collaborative relationships with these professionals. And these folks include not only retina practices, but all sorts of professionals, both in the eye care arena and then also in other aspects of the low vision kind of communities. And we'll talk through that a little bit more. We want to inspire professionals to refer, you know, patients and individuals with vision loss or their loved ones, if it's a family member that's affected, to the foundation for resources and support. And then we want to educate these professionals about all of the resources that are available, not only to patients, but also to them through the professional outreach department and to the foundation. And one of the things that I really want to drive home today is I want to make sure that everybody on the call fully understands the MyRetina Tracker genetic testing program. So that's kind of an overview of who we are and what we do. So as we're going through these slides today, you're going to see that this is a much different approach than you probably typically have encountered through the foundation. Obviously, we're a nonprofit organization and we have to fundraise. So most of what we do is fundraising in nature. However, with the professional outreach initiative, we are not, that's not our direct goal. Fundraising is definitely something that comes out of outreach efforts, but it's not what we set out to do. Our goal is to really build and cultivate long-lasting partnerships with the eye care professionals that we connect with to provide both patients and providers with resources. Through strengthening our ability to connect with professionals, you know, we can get to individuals with vision loss earlier in their journeys, and hopefully have eye care professionals connect them to our organization much more soon in the diagnosis of their retinal disease. And I think that you'll come to see, and hopefully some of you have, or you know, have heard about experiences where professional outreach has led to event sponsorships, donations, and things like that. So inevitably and indirectly, what we do does lead to fundraising. It allows us to cultivate warm relationships that then lead folks that we connect with to want to participate in events, donate, and sponsor. Next slide, then. All right. So when I am working from a national level on outreach efforts, the nation is my territory. So what I've tried to do is develop centers of influence, one person, one point of contact, one group that can influence or connect with a larger audience. Some of these centers of influence or these channels that I utilize for outreach efforts include key opinion leaders, both in optometry and ophthalmology, professional organizations, groups like Vision Serve Alliance, the Association of Schools and Colleges of Optometry, state affiliates for AAO or AOA, the Optometric Retina Society, different organizations and groups like that. We've connected with a variety of schools and colleges of optometry. This is great because we can impact students and residents before they even get into practice. And hopefully they'll think about the Foundation Fighting Blindness early on when they interface with patients with an inherited retinal disease. So that has been a really good avenue for us. Of course, large eye care clinics, retina practices, ophthalmology. There are more conglomerates out there. And if we can, get in with one key point of contact, we are able to share our message with sometimes hundreds of eye care professionals within one group. And then the low vision community and professional leaders. These can be rehabilitation facilities, state departments of vocational rehab, occupational therapists, low vision specialists, and other organizations that work in the low vision community. Ben and I have participated in a variety of conferences. Of course, pre-COVID, we did a lot of traveling, especially Ben, and that was a way for us to network with other professionals. And we made some really great connections through those conferences that we attended. And then last but not least, I've worked with several chapter leaders across the nation in different markets to help with what we're here to talk about today, and that's chapter-led outreach. So I think it's really important as all of you are sitting here today and thinking about this as, considering, is this something that I want to do? As a person yourself with either an inherited retinal disease or the family member of someone who has an IRD, you are very likely the ideal spokesperson for professional outreach. You have a personal story, you have a passionate connection with the foundation and with this journey. And so, you really are the ideal advocate for who we are and what we do with professional outreach.
Hey, Michelle, can you hear me? Okay.
I can.
Okay.
Yep.
Your voice is fading in and out just a little bit. I don't know if you can project a little better.
Okay, sorry.
Okay. No, it's not bad, but okay, that's better.
Sure. Okay. So, if you decide that you want to take part in professional outreach at the chapter level, you're not going to be just thrown to the wolves, if you will. I do provide a lot of guidance and have, put together a real program, if you will, for getting people ready, I hope, to do this. It's not always the easiest thing. You do have to take some risks and maybe tap into some scenarios where you're maybe not as comfortable as, as you've been in previous things you've done. But the way that I structure this is we have an introduction call. This is kind of an initial call for me to introduce myself, to share some information about outreach and what it is, and for me to learn about you as well. Once you decide that you want to do outreach, what I do is develop a list of targets And I provide those based on your geography and based on, you know, where you're comfortable and really reaching out to. That could be maybe 30 minutes from where you live. It could be an hour or 2 hours from where you live. I give you an overview of information to gather and some talking points. You know, when you start to do outreach, what are you going to be discussing? What do you need to do? What do you need to gather? We'll practice sharing personal stories and talking through that. It's important that you're comfortable with that, in my opinion. And also, you know, I want you to be prepared with questions to ask during your calls and contacts. And then we will have check-in calls. I, at this point, have either phone calls, or I check in via email with all of the leaders that are doing outreach. And this is a two-way street. I mean, it does require you to participate, as well as me setting up those meetings. And then, of course, during these calls, we're gonna, discuss things that are ongoing, discuss your progress. We'll determine the best time to turn over leads, if you will, when you want me to get involved. And everybody's a little bit different with this. So it's something that I want to tailor to be comfortable for you in your outreach efforts. So who are the targets for outreach? I like to talk about what in the sales industry is called low-hanging fruit. And these are your personal network of folks that you've already connected with, either as a patient or as the family member of a patient who has an inherited retinal disease. These are the eye care professionals that you see once a year, or the vocational rehabilitation counselor that you've seen, or your family member has seen for work-related items. So that will be a first point of contact. That's a warm lead, and that's a good way for you to get your feet wet. Of course, optometrists and ophthalmologists locally, and this does include retina specialists, but it's not just retina specialists. It's going to be pediatric ophthalmologists, it's going to be low vision specialists. Those groups are the largest groups that see folks with inherited retinal disease. Of course, we will connect with some of the larger ophthalmology groups and some others, but those are the primary ones that I suggest that we target. And then, of course, there are other professionals that I've mentioned, like the rehabilitation services, vocational rehab, occupational therapists. And then also, sometimes it's really good to connect to schools for the blind. You can connect with administrators or teachers or counselors. Sometimes they're a good resource for us with outreach, and those are good connections. So usually one of the very first questions I get is, how do we do this? Am I going to these offices? Do I have to travel? I work on a national, from a national level. I am in South Alabama, and almost everything that I do is over the phone. And I don't expect you to do anything different. So most of what you do would be over the phone, emails. And then if you have personal appointments, those are really good opportunities to share some information with the office and staff and physicians while you're there. Now, there may be some other scenarios where you have an on-site meeting, or you're able to schedule time to speak with a practice manager, and that's fine, but most everything is done over the phone. Some information to gather. Is this an appropriate target? I mean, do they see patients with an inherited retinal disease? If not, who do they refer to? Because we want to make sure that we're adding those targets to our list as we're, getting familiar with folks in our area that are good targets. Who is the best point of contact at that particular facility? And what kind of information can I gather? I mean, is it the practice manager? Is it the clinical coordinator? Is it a patient liaison? What's his or her name? What's her direct number? Does she have an extension? What is his email address? When is the best time to reach him? Does he prefer to schedule an appointment, or should I just call in a day when he or she is not in clinic? So those are some things that we want to gather during the call. And then, do they know about the foundation? And it's okay if you call somebody who does, and maybe you didn't know that. That's a good opportunity to say, wonderful, thank you for your support in the past. We have something new that may be of interest to you and your providers, and you can share information about the foundation that way. And then, of course, what are the next steps for moving forward? As you're connecting with these groups, it may be that the first call is just to gather a name. And then, you piecemeal this together, baby steps to figure out the whole story so that you can figure out what triggers interest for whatever group you're targeting. Okay, so talking points. I love sharing personal stories. I think that sharing your personal journey with vision loss, your experience with the foundation, your family members' journey, those are really great ways to connect with the people that we're trying to connect with. It makes us not a salesperson, we're a patient. We're someone that they can identify with. We're someone that they want to help. So I really encourage personal stories to be shared. Of course, we want to make sure that we talk about the mission statement. We drive research to find treatments and cures for inherited retinal disease. That's who we are, and we want to make sure that you're familiar with our mission statement. What resources does the foundation have to offer? Of course, you are all very aware of the local chapter. That's something that you're going to want to share. Why is that important to you? How has that impacted your life? Why should it be important to them? What are upcoming events that may be of interest to both the patients that they're serving and also the providers? And we now have a variety of events for both. Research updates, disease information, clinical trials. Of course, Ben is wonderful at sharing that, and he is always a resource for presenting that information. And then the MyRetina Tracker genetic testing program. And this is something that I want to spend a minute on. Then you can go ahead, go to the next slide. I think it's really important, even if you don't decide to participate in professional outreach, as a volunteer with the foundation, knowing what the MyRetina Tracker program offers, I think is vital to all of us. And it's information that, I hope that you're able to share with others who have vision loss. So I'm going to go through this just because there may have been, we've had some changes to the program, and there may have been some things that you weren't familiar with. So first of all, the MyRetina Tracker genetic testing program now is a partnership between Blueprint Genetics, Informs DNA, and of course the Foundation Fighting Blindness. This is a very holistic approach to genetic testing. We are able, as the foundation, to provide resources and support in addition to all of these other aspects. So Blueprint Genetics, provides the genetic testing, and the panel includes 322 genes, a very good panel, very broad. Informs DNA is who provides the genetic counseling. Their counselors are very well versed in inherited retinal disease. They're very patient-centric and just an excellent counseling program. I can't say enough good things about Informs DNA. And then, of course, the MyRetina Tracker registry, which allows patients to raise their hand and be seen by the research community to be potentially identified for clinical trials. And, again, the support overall of the Foundation Fighting Blindness. This is a free program. The genetic testing, the genetic counseling, the registry, there's no cost to any of these items for patients or providers. All patients in the United States who have clinically been diagnosed with inherited retinal disease are eligible as long as they haven't had testing over the last 4 years with a panel of more than 32 genes. Now, I do want to emphasize that this is for patients that have been clinically diagnosed with an inherited retinal disease, not macular degeneration. So just note that. Eye care professionals in the United States, if they can diagnose a retinal disease, they can utilize this program. And everything is confidential. Privacy is adhered to, and I think it's really important to to know that. We, as patients, we don't want our information to be shared with the audiences that we don't, give folks permission to share with. I want to pause for a minute. Ben, is there anything you want to add in regards to the genetic testing program?
I'll just make a quick comment. I'm getting the program that we offer. Are you guys hearing my feedback?
Not bad.
Okay.
Yeah, I've got it. I'm hearing it.
Okay. Let me try one more time.
That's better. That's better, just like that.
So the Foundations program, the panel from Blueprint is both very broad and deep. The genetic counseling program from Informed DNA, they are really second to none in the United States as far as their genetic counseling experience and knowledge of the IRD space, and of course our registry. There is another program offered by Invitae and Spark Therapeutics for genetic testing. Their panel is not as broad and deep. They don't require genetic counseling, and the participant signs away their right to privacy when they participate in their program. So I don't expect you to get into a competitive discussion about our panel versus the Invitae Spark panel, but our solution is superior. And at the end of the day, we're really looking out for the patient and just trying to help them and their family not only get screened and identify their mutated gene, but also help them understand what that result means through genetic counseling. We're interested in finding the mutation, whatever gene it's in, whereas Spark obviously has a vested interest in RPE65. Spark is the company who developed Luxturna. So anyway, I just wanted to give that quick competitive comment, and we can talk more about that now or at a later time if you want. But I'm very proud to have this program available for our patients.
And, if you can you all hear me?
Yes.
Okay. If you elect to participate in their outreach program and you're ever in a scenario where the question arises, how does this compare to the Spark Invitae program? Ben and I are happy to jump in and help to field that question. So, we're here as a resource. So, but I wanted to go through this because I think it's really important for everybody to understand this program and the fact that it is available now very widely to patients across the nation. So. Okay, so what kind of things can we provide as a professional outreach department? We do have collateral, materials, brochures, pamphlets, disease literature, all of those types of things that we can send to clinics once we've connected with them, and if they want those resources for their patients, to hand off during appointments and such. We also now host a variety of webinars and teleconferences to discuss all sorts of things, foundation resources, obviously the MyRetina Tracker genetic testing program, research updates and clinical trials. And now we even offer continuing medical education for eye care professionals, which is a very big add. And we do have patient support offerings as well. We have a phone number, we have an email address, and of course our website, is always available to patients, as well as, the chapters. So there are a variety of things, both from a professional scenario and personally too, that we can offer as resources and information to these clinicians and practices that we're connecting with.
Keep going.
Okay. So if you are thinking to yourself, I might want to get involved in professional outreach, First of all, thank you. There are some things that I want you to ask yourself though, because as a volunteer, the last thing I want you to do is dedicate time and energy to something that just isn't perhaps a good fit. So some questions that I would ask if you're considering getting involved is how much time do I have to commit to outreach efforts? Is it, you know, an hour a day? Is it a few hours a week? Is it a couple days a month? Certainly any of those are very welcomed and we're grateful for them. But you do want to make sure that you're going to have some time to carve out to dedicate to this. Also, am I willing to do cold calling, you know, to clinics? It's something that it sounds very easy, but it can be a little nerve-wracking, especially the first few calls that you make. So, you know, that's a question to ask. Do you feel comfortable in sharing your personal story? And also communicating your connection to the foundation. And I will be honest, I still sometimes struggle with sharing my personal story. It's something that I have had to, you know, to become more comfortable with through my role. But it's not always easy to do, even for me. And I've been doing this now for a year and a half. So, you know, something to think. And then last, but certainly not least, will I be diligent in sharing information collected about contacts and my outreach efforts, not only with me, but also, you know, the events team and other folks. It's really important that if you're gonna, you know, participate in professional outreach, that you're communicating your outreach efforts with us so that we can make note of those connections and help you to strengthen and develop those relationships. As a professional outreach team, we send out a lot of information via email. We host a lot of webinars and things. Of course, the foundation's always hosting events. And I share that information with all of our contacts. The more times that they hear or see something about the foundation fighting blindness, the stronger their connection is to us and the more likely they are to think of the foundation when they are connecting with a patient who has a retinal degenerative disease. So that last number 4, I think, is really important. They're all important questions, but you know, certainly ask yourself these things before you commit to this initiative. Okay, and you know, of course, our team, Ben and I, and our admin, Katie. Katie didn't, unfortunately, she's not on the call today. We probably should have invited her to join, but I tend to handle all of the, you know, the day in, day out contacts, you know, clinic notes, connections, developing relationships. Ben, of course, is our science and research guru and heads up all of those types of conversation. Katie keeps us, you know, in line with our resources, mail outs, you know, things like that. So if we can be a resource, please don't hesitate to reach out to us. We do have a professional outreach webpage now, and there's the link. It's if you go to the website and click on genetic testing, you'll see a tab for eye care professionals, and that's where our information is stored. So that concludes my presentation. I'm certainly more than happy to answer questions that you might have, and you know, look forward to working with you if this is something that you choose to take on. So thank you.
Thanks, Michelle. I guess maybe one thing is just to open it up to the Washington chapter folks between Mike and Rob, Susan, Marcia, and Robert and Lupe as well. Are there any just general questions? I mean, we've all talked directly at one point or another over the last few months, and kind of need to think a little bit about, you know, what do we do as a next step? But before we get there, are there just any general questions at this point? Okay.
Well,
Yeah,
I am just, oh,
I'm sorry.
Yeah.
Mike
ahead,
here, and I just lost, there I am. I have a couple of questions. First of all, Michelle, thank you for the presentations, and it would be nice if we can get the slide deck just as a reminder note. Will they be available?
Certainly, we can provide those. Yeah, not a problem.
Relative to slide 7, the targets, I think we've done some good outreach in the past in Seattle with some of those other professionals, but the one that comes to mind, or two that come to mind, are Lighthouse for the Blind here in this area, who's now taken on the rehab services as well of predecessor organization, but it's great to have it in the Lighthouse. So I think we've got some good relationships there. And these are kind of new on this list. From the last time I saw it, we were targeted at the eye professionals. So I'm really glad to see those ads there. And I think that will be good in connecting the larger FFB organization to some of the folks like the executive at Lighthouse for the Blind, Cindy Watson, who's a big supporter of FFB, and I think can be a real advocate for FFB going forward. And then slide 12, outreach. Is there going to be a template for reporting out? Just what it is we would be reporting out. It would be nice to have a consistent format on that. So just a suggestion, or maybe you already have that.
Yeah, so I do have a spreadsheet that I put together for that, to record. And I will be honest, I have had less than a handful of volunteers who have ever elected to use that spreadsheet. Now I'm happy to provide it. I shouldn't say what most. I've had all sorts of different ways that information is communicated. I have one volunteer that prefers to call me and read out all of her contacts, and I type it out and then I send it over to my admin to get that information added. I have some folks that send an email with pertinent information as they gather it. I am happy to use whatever works best for each person, and I think that, depending on the vision loss, depending on kind of personality, different formats work for different people. So I try to provide a variety of different ways to communicate, and it doesn't matter to me how it's done as long as it is done.
So if you're populating a spreadsheet, there must be some key things you want us to be gathering information on.
Yes, and that is all stuff that we discuss during our one-on-one calls or team calls. I do have a couple of markets that have a group of individuals that are doing outreach, and we've started to do more team calls in those scenarios, but I have some markets that it's just a one-on-one. As I mentioned, I really like to continuously connect at least every other month via the phone and every month via email. And those are opportunities to share information, both about where the outreach has happened, contacts that have been made, things that I can help with, and brainstorm ways to progress relationships.
Thank you.
And Mike, I might add there that as a team here and as a group here, I'd be happy to serve in a means to compile that for the Washington chapter on a monthly basis, and then share that with Michelle. And then however we decide to set a cadence on having Michelle attend our meetings as well, then we can review that in real time, and we'll just iterate and get better as we go along. I have shared the spreadsheet with the folks on this call, if I'm not mistaken, that I developed locally. I've got no ownership issues whatsoever, no invented here matters whatsoever. If there's a better way to do it, all the better. But I just want to say I'd be happy to compile and maintain that info.
Yeah,
At the end of the day, it's just about contact. However it
Yeah.
happens, I'm excited about, because every touch gives us a better chance of being remembered when those folks come across a patient that we could help. So.
Awesome.
Thanks, Michelle. Thanks, Bill.
I have a question. This is Lupe. We are with Kaiser for Meneji. So, you know, we've got the one retina specialist for the whole thing, I think. And I know other times, like when Bob was trying to get his blood test and everything, the doctor just didn't seem to have any interest whatsoever in even knowing about the foundation. And I'm just not sure how to. I've got an appointment with him in September, and just wondering if there's something that someone could tell me to maybe at least introduce him to it some way, get him interested in it. I don't know, but being that he's in, you know, it's one of these Medicare Advantage things, maybe he can't. He's not supposed to take any outside suggestions as to, you know, things to tell his patients. I don't know. It was just a question I thought maybe I would ask about.
And a very good question. And, you know, I'd like to start by saying that we're not going to get every eye care professional or every professional to love the foundation and see the value in the foundation that we see. And that's okay. Groups like Kaiser they're challenging because there are, you know, they do have corporate driven, you know, methods and corporate driven initiatives and restrictions and such. Now, I would say, and one thing that we have done is initiated our continuing medical education courses. Continuing medical education is something that all eye care professionals need, and they do have a certain number of credits that they are required to gather every year. We launched our first continuing education course in May, and we did have some Kaiser participants. So that tells me that they can participate. You know, in some cases, it's just figuring out what triggers a response. And just like people are different, doctors are different. So I wouldn't give up, but I also wouldn't get frustrated. Maybe the next time you go in, I can arm you with, you know, some of our continuing education information. We do have another course that's going to be coming up this fall. And maybe that will be a way to spark interest if other avenues haven't. That's just a thought that I had off the top of my head, but, you know, I'm certainly happy to talk with you about some other strategies, you know, before your next appointment, if you'd like.
And Lupe, hi Lupe. One thing to keep in mind about our genetic testing program, insurance doesn't get involved at all. The doctor goes straight to the Blueprint website and orders the test and the counseling online without any insurance company involvement. So I could understand why he or she may be a little confused and think they don't know how to handle it administratively. And there might be other barriers, I don't know. But I think that's an important thing for the doctor to know. There's no cost and there's no insurance involved. They just order it straight from the Blueprint website. And Michelle, I was thinking maybe if you can send Lupe the provider guide and she can hand that to the doctor. So that little guide basically says what I just said. It shows him or her how to order the test. Again, they may still have issues because they don't want to go outside their protocol, but there's no money to worry about. There's no insurance company to worry about.
So
yeah, I can absolutely provide that.
I wonder, Ben, if there's some you know, some concern on their part that they have to spend time that they don't get compensated for administratively You know, it's a no cost effort, but if they're working for the whole Kaiser Permanente organization, they don't have a lot of spare time to do uncompensated work.
Right, and that's I understand that. I think it's a good point, but the patient still has to pay for the appointment itself.
Absolutely.
Now, the 15 or 20 minutes to enter the information in, to take the sample, that's correct. They aren't compensated for that, but hopefully they're healthcare professionals and they can bend a little bit to
Yep.
try to help their patients, but
Agree.
not always.
I'm not seeing him as Scrooge, but a big organization and potentially very loaded in their work.
Right. No, it's a good point.
Mhm.
So that spawned from your original question, Mike. So thanks. Good discussion thereof. Marcia, I think you were gonna ask a question right at the same time Mike was.
Actually, I wasn't going to ask a question. Thanks for noticing. I was going to make I'm still in my first cold call with the retinal specialist, the one retinal specialist here in my city. I think that a lot of the eye care professionals in this geographic area refer up to OHSU, the big KCI Institute, which was an Elks original foundation. So I even think the local Kaiser here, they refer out for really specialized things. You have to get the doctor's attention, though, that you have something that is outside the scope of what that they can treat, and they will refer out. But it does take sometimes some fierce advocacy on the part of the patient to get there with Kaiser, because they are expected to see a certain number of patients every day. They're very, very like they're in little specialty bubbles in Kaiser. You see this doctor for this orthos for knee, but you see somebody else for shoulder. If it's on the job, you see a completely different group. And Kaiser is structured that way, which makes it hard to know who to contact. I just wrote that down because we have some Kaiser clinics around here, Michelle, and I didn't. I haven't even thought, they weren't even on my radar. So probably they should be. But I'm assuming that some of the doctors here would be referring IRDs out. That's what happened with our daughter. They were suspicious, so they sent us up to KCI.
Yeah.
So, but still, the medical continuing ed, just the knowing what to do with their patients when they do come through and they are suspicious for an IRD, the resources of where to go and what to do.
Mm-hmm.
So that's not as hard. It just depends on how they're networked. I'm still figuring that out.
Yeah.
So.
Yeah. A lot of trial and error. Hey,
It is.
I do have a question for Ben and Michelle. Just a genuine curiosity here. Is there some background information or just rule of thumb you could share with respect to, if and as we approach, a retinal practice, how, what is there, it's not a caseload. How many patients does an individual physician have roughly? And of those patients, what's a number to expect or, have an IRD of some sort? Right, because it gives me a better feel for, just how often are they going to encounter, or maybe they already have folks in their practice, right? Patients who already have, they've already diagnosed with IRDs, but it's new ones and other referrals. So I guess I'm just genuinely curious about, what are the numbers behind this?
I don't know that there's a way to quantify because of the fact that every practice is so different. Every physician's caseload is different. Ben would be better equipped to speak to, generalities about how many IRD patients there are nationally, but I don't know, and maybe Ben, you do, I don't know of a number. I will say that what we've seen through outreach is that the communities that are engaging and wanting to share our information, the professionals that are wanting to engage and share, are the ones that work almost exclusively with low vision patients. And that's your low vision community, your low vision specialists, your low vision rehab facilities, your OTs. Groups like that are far more open to our mission and message, in my opinion, than large retina practices. I know that doesn't address your question specifically, but I do think that it's important to note. Ben, I'm sure you have some knowledge to add, and as far as
Well, what you said, obviously, we've learned this, and we were a little surprised at first that a lot of retina practices aren't so open. I think it is a pretty small percentage, but I think in a way, what you're looking for is a personality of a retina doctor that really wants to help their patient. Because a lot of large retina practices are dealing with AMD, diabetic retinopathy, maybe detached retinas. And there are things, those are businesses where the doctors are making some money. The AMD shots, the diabetic retinopathy shots, surgeries to fix detached retinas, those are all revenue streams. IRD patients, not so much. So I think in a way, it's finding a personality of a doctor that is really in it to help their patients, even if it's not a lot of patients. And we find those people. But hopefully you can learn that as you contact practices, you get a sense for who really makes a good quote unquote customer, where, yeah, a lot of these places, they're revenue driven.
well, and two, I think it's important to note that it's not always the doctor who we need to connect with in these practices. You have practice managers, you have patient liaisons, you have clinical coordinators, you have all sorts of other professionals who may be more willing to share our mission and message with patients than the doctors. So I think that it's important to remember that when you're making calls. You're not going to call a clinic and get a doctor on the phone. I mean, if you do, you are so lucky. Maybe a low vision clinic, but 99.9% of the time, you're going to be very lucky to get a doctor on the phone or to get in front of a doctor unless you're at a patient appointment.
Yeah.
So,
Well, that's a great point. And in fact, so it kind of changes my view of things a little bit, just from the standpoint of where do you cast the net for the biggest return. And I think you hit on something immediately, which is everyone in our chapter should, whether it's them directly or their family member who is in the care of a local physician, should be reaching out to that individual, right, in their next appointment, and use, take their 15 minutes to half hour appointment and, save 5 minutes and talk about the foundation and the great stuff that's going on, and get a direct, contact for how to follow up. And that gets you, and Mike, you could probably talk to the number of chapter members that could affect. And then we also have lead physicians here locally between, Gary Chung and David Saperstein. And of course, we've got the Lighthouse as well. So it's what's that next, high potential candidate list, right? And I think that really can come derived from our chapter members and the practices they're close with, rather than, as opposed to, here's a list of 40 practices, start your cold calls, right? I mean, I think the former is a recipe for higher success.
Yeah.
So that might be something we need to undertake as a Washington chapter activity, and Mike and Rob, maybe we can talk offline a little bit about how to, and Michelle, incorporate that into our monthly meetings and get folks you know, the right information and use our chapter meeting, you know, a portion of the agenda just to keep a tab on how folks are doing in that respect.
Well, and something that I didn't mention in the presentation, but this is a strategy that we have utilized during patient appointments is, you know, if you'll let me know, well, if you decide to become involved with professional outreach, we're going to get some materials for you. We have folders and brochures, and I have a form letter about the foundation and our resources. There are several different things, the clinician one pager on genetic testing that Ben mentioned. And what we do is we get that to you, you know, so that you have some of those items for the opportunities that you have on a personal, you know, from a personal standpoint to get in front of these professionals. But what I've started to encourage folks to do is when you go in for your appointment, take a folder or 2 or 3, give one to your doctor, but also ask if you can speak to the practice manager. Ask if you can speak to the tech that's working with the doctor. Ask if you can speak with a patient advocate while you're there. And you can get in front of people that way and share our information. And if you tell your personal story not to the doctor necessarily, because it's quick and they are trying to see patients, but to these other folks, it's a great opportunity to really connect with those people in those offices, and they interface with patients all the time. So, you know, something to think about.
And just to add one other strategic thought, I think the one thing that the retinal community is learning more about, thanks to some of the companies in this space, is genetic testing. And that might be a good thing to lead with early in the discussion, because that may be something that will resonate with them. That oh yeah, I'm learning, and I'm speaking as if I were a doctor, but they're learning more and more about genetic testing, and that might catch their ear. Again, because other companies are promoting it, and if they know that we're providing it as well, they may want to learn more about it if they do genetic testing. That will tell you a lot, I think, about a practice. If they're interested in genetic testing, then that might be a good qualifier.
Great to know. Yeah, thanks, Ben. So I'd be interested in comments, but I think one takeaway is definitely for the local chapter here to start, you know, as we engage with the local members, and Michelle, maybe Glaze, maybe you can tell us what's the best way. You know, just say, hey, if you've got an upcoming appointment, we'd like you to reach out to Michelle Glaze directly and arrange to have some you know, brochures sent to you directly to take with you, and she can give you a couple of words advice, you know, in terms of what to say or who to ask for at your next appointment. Does that sound reasonable?
Absolutely, I'd be happy to.
That's awesome.
Yeah, and Bill, this is Rob.
Hey, Rob.
I kind of feel like we don't have a great idea of what all of our members, like which practices they actually go see. Like, do we, and learning more about that would let us, like, both our really active members on calls, and then just the other folks as well. Understanding where they're spread out here would be interesting too.
Yeah, that's a great point. So how do we get? Do you want to spend time here on this call? I mean, how do we get that information?
I would think that is getting to know our members better.
Yeah.
And as we reach out and know them better, like write this kind of stuff down about them as well. So maybe it's not more, you know, both a member list and a practice list are important to grow together.
Do you do any sort of, is there any sort of survey on chapter level? And I'm totally speaking off the cuff. I have no idea.
Yeah, I was
about
thinking the
this.
same thing, Michelle. Is why not do a survey? But yeah.
Yeah, I mean, you could, through that survey, you could gather all sorts of information. What kind of IRD do they have? Are they affected? Is there somebody in their family that's affected? Why did they get involved with the foundation? What types of events are they interested in? Who is their eye care professional? Have they ever been to a low vision specialist? Are they receiving vocational rehab services? I mean, it could be something that's sent electronic, and then it can be a discussion during a meeting. And that's a great way to gather all sorts of information about your members.
Well, why don't we do that? Why not? We take a shot. I'll look to Mike and Rob, the chapter leadership here, but Michelle, I'd be happy to work with you on, what are the key, questions in a survey we'd like to get nailed down.
I agree. I think that would be great. What we normally do is when, of course, we can have events in person, we do provide a survey at the end, and it includes some of the questions that Michelle Glaze touched on, such as how did you find out about us? What are you interested in? Do you have an IRD? If you don't, or just a family member, etc. And we do input some of that information into our system, but we do not ask questions about, do you see a retinal specialist? If so, who is it? Do you see a low vision specialist? If so, who is it, etc. So I'm happy to work with you all to create something and send it out to our chapter members.
Great. Great.
Does anyone else have any? Oh, sorry, Ben.
Well, just one other quick thing. I don't know if this is a carrot for the doctors or not, but we're trying to build our list of retina doctors and eye doctors who see IRD patients. So we can, if a doctor wants to be listed on our website, we can add them if again, they regularly see IRD patients.
Mm-hmm.
Where is that list that we currently have?
It is under, if you go to our website, it's under, I believe it's under newly diagnosed right now.
Mm-hmm.
Okay.
All the way on the left.
Off of the 4 eye care professionals pay? Oh, no, I see. I see what you're talking about. Yeah. Retina doctors. Yep.
Right.
Awesome.
I think if we're asking people for their eye care professionals, we probably need to be addressing the why of that too. Just
absolutely. Yeah. I think that's all got to be couched very, very carefully with utmost privacy, of concern for sure.
Right.
And so I'll look to the two Michelles to coach us along there.
Yeah. So just looking at the retinal specialists, we only have David Saperstein and Jennifer Chow listed for Washington, and those are both Seattle based.
But
yeah, we're happy to add more people that you think are appropriate, and obviously want to be on the website. So,
okay.
Eye Associates Northwest has retinal specialists, as certainly Evergreen has probably several retinal specialists, but they've been more focused on the coping with the IRD than with I think really working at the level that Saperstein and Chow have, a little bit more directly tied to the research still.
Yeah. But Rob, I made a note here that, as part of all this, we should, keep tabs on, what are some of the incentives for the MDs involved, both in terms of pointing them to free genetic testing through the foundation and Blueprint, as well as, let's get their names on the website if they so choose. Good idea. Good.
Does anyone have any other questions for Michelle Glaze and or Ben at this time?
I have a question for Ben, but it's not related to retinal or the outreach program. It's more associated with my daughter Caroline's situation on testing she's undergone. But
if you don't mind everybody else hearing.
Oh, not at all. So Caroline's our daughter. She's 23, diagnosed with RP some time ago. She's had genetic testing through Blueprint. And this is pure coincidence. Her brother works for Invitae. And so we did their panel as well. They both showed the same results, by the way, Ben. Not one wasn't superior to the other. Just kidding, though. Inconclusive. So she's in that group. I don't know what the percentage. I've heard from 20 to 30% of those. And so also submitted samples to the Massachusetts Ioneer group as well as Baylor. So I've not heard the outcomes of those inputs. We also had her entire exome panel done through GeneDx. So again, nothing conclusive. So the question is for a patient in that scenario, Caroline has a couple of other, not debilitary, but she does have some unique genetic, I don't know what the right word is, but conditions. And is there something a generalist could offer that maybe an IRD specialist in the genetic testing could not offer? And should we be also, having her looked at by somebody who's looking outside just the IRD panels?
I would say yes. I'm curious what, and I realize may not be the forum to talk about such a thing, but some IRDs are part of a syndrome, and it would be interesting to explore that. And again, I don't know if you want to get into what some of those other issues are here. We could talk offline, but you might want to explore that with a generalist to see if they're related, and that could provide some clues into what the genetic cause might be. I will say you're certainly getting great coverage if you're getting whole exome sequencing and you're reaching out to Mass Ioneer and Baylor. A lot of mutations can occur outside the exome. I guess one question I have, are there any genes that are suspicious where maybe she has one copy of something that might fit her clinical diagnosis, you just haven't found a second copy?
Yeah, so RP1L1 was found, SLC7014 found, and the COL18A1 was found. Those are the three, I believe.
What was the first one again?
RP1L1. Does that make sense?
RP1L1.
Okay. It could be a typo. But these are just variations, nothing conclusive.
Right. And I'm sorry, we're getting into the weeds.
Yeah.
Say they're associated with RP.
I'm sorry, I missed that. What's the first part?
Let's talk
offline. Yeah, I'd like to talk offline. That'd be great.
If you want to email me those genes,
sure.
I can look and see if they're associated with RP or a syndromic condition.
Sure, that'd be great. Yeah, so the counseling we've gone through is through Dr. Panisi's office in OHSU. But that's, so we're getting great care in that respect. But now it's,
well, if
be it inconclusive, then that's the next level of questions.
Right, but I have to say, if you're talking to Dr. Panisi and his team, that's pretty good.
Yeah. I mean, they've said there's no known syndromes for everything that I've been able to disclose to them.
Okay.
So
yeah, then, if they don't think so, I would think probably not.
Okay. Well, it might be good just to have her see a generalist here locally as well. So I'll check with Dr. Panisi and see if we can do that as
Sure.
well. Okay, very good. Thank you. Sorry to distract the call there.
No, that's okay. But you're really covering all the bases. I congratulate you on that.
Oh, thanks. It's good news and frustrating news all at the same time.
Sure. And I guess a comment while we're talking about research is, there are cross-cutting therapies that are emerging that work independent of the gene.
Right. Yeah.
So keep those in mind, though, if your daughter has some other issues that may not make her the best clinical trial candidate. But
Right.
each trial is its own entity, and Dr. Panisi would be a good person to stay in touch with about emerging cross-cutting therapies.
Good. We're on the same page. That's where we left off at our last appointment. So we'll make sure we follow up on it.
Okay, good.
All right.
Well,
Thanks, everyone. Appreciate it.
I want to say thanks to
Yeah.
Michelle Glaze and Michelle Goldfarb Shapiro for organizing this, and Ben for you taking time to meet with us. Thank you all who participated tonight as well.
And thank you all for your interest in everything that you do for the foundation.
Thank you, everybody.
Great.
Thank
Great.
you so much, Michelle, and thank you, Washington Chapter and Ben. We really appreciate it.
Got some homework to do, but that's okay. Thanks, everybody. Appreciate
Good
it.
evening.
Muted.
All right. Good night.
Bye-bye.
Bye.
Good night.
Bye.
Bye all. You all.
Bye.
Bye.